I'm Laura. I am a physical therapist with Care Options for Kids. It's a lot of fun because legit, all I do is play all day. So if you really want to play all day and just have a little bit of paperwork to do, it's the best thing ever. Presley is 8 now. So when I started with her when she was 3, she was sitting up a little bit, but not a lot. So now she's doing a lot more.
Presley, when she was 5 months old, was diagnosed with brain cancer. And so basically the first year of her life, she lived in the hospital. And then when we got to bring her home, obviously there were lots of delays and learning all these things that we're gonna have to do for her. And seeing her then and seeing her now, it's a miracle. For the first 2 years, I mean, she didn't do anything. She didn't sit up, she didn't do roll, nothing. And then slowly, just with family, therapists, friends, everything just coming together, this is this little miracle we have today. So therapy has been a huge impact. So being at home really puts my mind at ease, and the therapists just work with us. If something happens, we just flow, we've got everything here. And for me, having Presley in the home with the therapist, this is where she's gonna be. She's not gonna be at a facility. And so having my therapist show me, this is how you can help her stand, or this is how we can help her sit on the couch, this is how she, put her toy a little further away that she wants, she's gonna reach for it. So this is in her home environment, and I think that's helped her thrive. So it's neat with all this therapy and now seeing, and her oncologist, her neurologist, cannot imagine. They look at her and they're like, she's a true miracle. And it's because of the love and support that we get.
She's sitting, she's wanting to sit and play, which for the longest time she just wanted to lay around and play. So I actually prefer the home just because you can kind of see them in their natural environment. And kids tend to be a little bit more comfortable in their home sometimes than they do in the clinic. So we have our schedule that we can kind of create that works around what works for us as a therapist and how our life works. I have the ability to create that flexibility in my schedule. So days that I want to be done earlier, I can be done earlier. We have team meetings which help create that unity amongst all of the different disciplines and everything, which is really nice because then you can talk to colleagues and be like, hey, I have a patient like this, can you help me? Or do you have any ideas or suggestions? And just really bounce all of those ideas off of each other.